Health and Human Services Communications Chief Michael Caputo announced a leave of absence today. It comes after he urged President Trump's supporters to prepare for a left-wing armed insurrection. In a statement, HHS announced Caputo's leave would last for the next 60 days in order for him to, quote, focus on his health and the well-being of his family. An aide to Caputo, Paul Alexander, is leaving the department permanently. Over the weekend, Caputo accused government scientists of withholding effective COVID-19 treatments to hurt President Trump in a bizarre Facebook Live video. He also criticized Democrats and said he was under attack by the media.
I'm not going anywhere. They're not going to run me out. If the president asks me to leave, I will leave. I really want to leave. Some of you who know me know my health is failing. My mental health is definitely failing. I don't like being alone in Washington. They want me gone. I'm not going anywhere. I don't care. They protested in front of my apartment in Washington yesterday. I'm not going anywhere. The problem is in Washington, I can't carry a gun. I can't be armed.
Caputo has been under fire after Politico reported last week that his team tried to alter data coming out of the CDC to closely fit the president's statements. The reporter who broke that story, Politico's Dan Diamond, joins me now. Dan covers healthcare for Politico. Hi there, Dan. Good to see you again. Thanks for joining us. Since your reporting, there has been a series of events leading up to this moment of Caputo now going on leave. Walk us through what has taken place since you broke the story.
So in the past week, Michael Caputo has been under scrutiny in the public health community and on Capitol Hill. The effort by his team to change the Center for Disease Control's scientific bulletins, the morbidity and mortality weekly reports that have been around for decades and have been sacred texts in the medical community, that unleashed new scrutiny that his team was trying to put politics above science. It led to the opening of a congressional investigation on Monday. The Select Committee on the Coronavirus in the House called for interviews with Caputo and his aide, Paul Alexander. That's quite unusual. And meanwhile, there were some Republicans and Trump officials who also felt that this crossed a line and put pressure on the health department to either rein in Caputo or to get rid of his aide and perhaps Caputo himself, at least through the election.
And you also report Caputo and his team have attempted to add caveats to CDC findings, even attempting to retroactively change agency reports about the risks of COVID-19. What more can you tell us about that?
These reports come out several times a week. There might be 6 reports, 7 reports. Michael Caputo and his aide, Paul Alexander, believed that buried in those reports were data points or framing that was designed to hurt the president. They believed that scientists were being too pessimistic, that they weren't buying into President Trump's more optimistic message about the state of COVID-19. As a result, his team, Caputo, Alexander specifically, pushed to get access to reports early, to go back and retroactively add caveats, if possible, to existing reports, and at one point threatened to stop publishing these reports altogether. I should underline, these reports are essential for communicating what scientists at the CDC know about the state of COVID-19, who's likely to get it, how we stop it, and the state of research coming out of the agency.
And just to be clear, Dan, as someone who covers healthcare, is it normal for there to be any kind of political involvement when it comes to CDC reports?
To be totally frank, in any administration, there's going to be some political pressure. And I've talked to people from the Obama administration, from the George W. Bush administration, who said we weren't always thrilled when the CDC came out with a damaging report on Tuesday. Sometimes we might have wished that that was Wednesday or Thursday. But no one has ever, in my recollection of covering the administration, tried to go into the scientific bulletin itself and edit it or retroactively change it. That is a world apart from where we have been. And I think the concern is once you start tweaking the scientific bulletin even a bit to add these caveats, to add the more optimistic take that Caputo and his team wanted, where do you stop? What is the red line to keep science protected and keep Americans protected too?
Right, and you have to think about people's faith in these institutions being undermined when you hear reports like this. So one of Caputo's top aides, Dr. Paul Alexander, is also set to leave HHS. What's his role been within the agency?
His role has been a mysterious one. He works out of Caputo's public affairs shop, but he serves as the assistant secretary's personal, or at least he did serve through today, as his personal scientific advisor. This was a new position that Michael Caputo created. Paul Alexander is an old friend of his. He used to appear on Michael Caputo's radio show. He's a part-time assistant professor of health methods at McMaster University in Canada. And what perplexed so many health officials is why, in a government full of scientists, Michael Caputo needed to bring in a scientist of his own. And this unusual arrangement appears to have come to an end. In addition to announcing Mr. Caputo's medical leave, the health department announced that Paul Alexander would be leaving the department too.
So Dan, what can you tell us about the current relationship between HHS and CDC as it stands right now?
It's not great. HHS is the umbrella part of the health organization of the United States. CDC is one of the agencies, but has been at the forefront of our pandemic response. It has also become a scapegoat inside the Trump administration for when things have not gone well. And there is some truth to that. The CDC bobbled the rollout of a test for coronavirus back in February. Had that gone well, perhaps the entire response looks different. CDC has also battled with the White House over a number of damaging leaks. The CDC was constantly blamed inside the Oval Office and the administration for these negative reports. And as a result, CDC has very much been on the outs. That's one reason why Michael Caputo and Paul Alexander felt so empowered to put pressure on the CDC. They believed that the CDC was working to undermine the president. I should say, we at Politico have not found evidence of the CDC muddling the science in an effort to hurt President Trump and his chances at re-election.
Really important point. Dan Diamond with some extraordinary reporting. Dan, thanks so much for taking the time to talk to us.
Thank you, and my colleagues at Politico have done great work too.